Hello from KFF Health News and starting this week from WAMU Public Radio in Washington, D.C., welcome to What the Health. I'm Julie Rovner, Chief Washington Correspondent for KFF Health News, and I'm joined by some of the best and smartest health reporters in Washington. We're taping this week on Thursday, October 30th at 10 a.m. As always, news happens fast and things might have changed by the time you hear this. So here we go. Today we are joined via video conference by Alice Miranda Olstein of Politico.
Hello.
Maya Goldman of Axios News.
Good to be here.
And we welcome back to the podcast one of our original panelists, Paige Winfield Cunningham of the Washington Post. So great to see you again.
Hi, Julia. It's great to be back.
Before we dive in, we have a little of our own news to announce. Starting this week, we're partnering with WAMU, Washington, D.C.'s public radio station, to distribute the podcast. That means you can also now find us on the NPR app. And welcome to all you new listeners. Okay, on to the news. We are now 30 days into the federal government shutdown, and there is still no discernible end in sight. And this Saturday is not only the start of open enrollment in most states for the Affordable Care Act health plans, which we'll talk more about in a minute. It's also the day an estimated 42 million Americans will lose access to food stamps after the Trump administration decided to stop funding the SNAP program. That's something the administration did keep funding during the last Trump shutdown in 2019 and, according to budget experts, could continue to do now. So what's behind this? As I think I pointed out last week, not such a great look to deprive people of food aid right before Thanksgiving.
So I think this follows the pattern we've seen throughout the shutdown, which is just a lot of picking and choosing of what gets funded and what doesn't. The angle of this I've covered is that out of all of the uniformed forces of the government, the Trump administration dug around and found money to keep paying the armed members, but not the public health officers who are also part of the uniformed branches of the country. And yeah, you're seeing this in the SNAP space as well. President Trump and his officials have, openly threatened to go after what they see as Democrat programs. So it's just interesting what they consider in that category. But you're seeing a lot of choices being made to sort of exert maximum political pressure and force various sides of this fight to cave. But we're not seeing that yet either.
Yeah, they are. I mean, it seems this is all so backwards because it's usually the Republicans who are shutting down the government, the Democrats who are trying to pressure them to reopen it. And now, of course, we're seeing the opposite because the Democrats want the Republicans to do something about the Affordable Care Act subsidies, and the Republicans are going after previously what had been kind of sacrosanct bipartisan programs like food stamps and the WIC program for pregnant and breastfeeding moms and babies. And now apparently they're going to stop funding for Head Start, the preschool program for low-income families with kids. On the one hand, you're right. There are programs that are, that are very cherished by Democrats. But I feel like this whole shutdown is now sort of going after the most vulnerable people in America.
It's also been interesting because Secretary Kennedy has tried to use SNAP as a vehicle for his Make America Healthy Again agenda, right? Trying to get states to limit the sugary drinks that their SNAP programs offer. And he's really touted that as part of the agenda. And now does not seem to be any interest from HHS in speaking out about that.
Well, of course, and SNAP isn't an HHS program. It's a program of the Department of Agriculture, which is even more confusing. But you're absolutely right. I mean, it's odd that some of the things that he's been pointing to are things that this administration is kind of trying to lay at the Democrats' feet as you want this program, reopen the government. So as I mentioned, Saturday is the start of Obamacare open enrollment in most of the states. And Paige, you got a sneak peek at the premiums for plans in the 30 states that use the federal marketplace, which is now open for what we call window shopping before open enrollment officially begins. What did you find?
Yeah, so I got some documents at the end of last week showing that the average premium for the second lowest cost silver plan, which of course is what we know, that's what the subsidies are are pegged to, is going up 30%, which is the second highest premium increase. The highest we saw was 2017 to 2018. But this is a really, really significant increase. And of course, CMS didn't include that number in the document that it finally released this week. So the documents I saw had some sort of, numbers like that, which were all like stripped out of the official documents. But all of this is just like so interesting because I was thinking about, back to 2017, 2018, and the politics of this are so flipped right now because basically it was the Democrats then who didn't want to talk about premium increases and the Republicans who were yelling about it. So it's funny how that has changed. But, I guess on the politics of this, it seemed for a while like Democrats were thinking maybe the November 1st start of open enrollment would kind of provide this out for them to pass a spending bill because they could say like, okay, we tried. Now open enrollment has started. The subsidy or the premiums are kind of baked. So like we can't really do anything to change it now. But I'm not sure. I don't think we're going to have anything this week. It seems like both sides are pretty dug in still. I mean, I guess the other thing I would say, like on these costs, it's really highlighting a weakness that we've known for a long time in the Affordable Care Act, which is that, like, yes, it made health insurance affordable for a lot of people, but there's always been this like smaller number of people that are above 400% federal poverty that have had no shield from insurance costs. They have the last 4 years, and now they're not going to have one anymore. And like, it's funny because Democrats are talking about this, but that's sort of a problem they hadn't wanted to acknowledge for a long time in the early years of the Affordable Care Act. And as you guys all know, there's not going to be any political will for like bipartisan work to create affordable options for these folks unless the subsidies get extended, which of course that doesn't seem very likely at the moment from how things stand.
Yeah, going back to what the Republicans sort of announced, their talking points is that, well, first, the premium increases aren't that big and that the expiring extra subsidies aren't that big a piece of it, both of which are actually kind of true. But of course, that's not where the sticker shock is coming from. The sticker shock is coming from the expiration of those tax credits. That's going to, so people who had been shielded from these very high premiums are no longer going to be shielded from them. And that's why, if you look at social media, you see all these screenshots now of, insurance that costs $3,000 a month for people who were paying, $150 a month, which is obviously not affordable. Why is it so difficult to explain the difference? I've been working on different ways to explain it for the last 3 weeks.
I was trying to figure this out last night when I was writing something for my newsletter today. And I think one of the really confusing parts about this is that, like Paige said, like Paige scooped, premiums are going up a certain amount. And that's not actually what people are seeing. That's not what almost anyone is going to actually face. Either you're getting that huge sticker shock because you're losing your subsidies that you had this year, or you're continuing to have subsidies. They're not quite the same, but you're still not going to pay a 30% increase. And so I think that that's really confusing for me even, and hard to explain. I think one way to think about this is like the party that is going to bear the brunt of the premium costs to a large degree is the government, because for people that are before 400% federal poverty, like they are basically guaranteed under the Affordable Care Act that they're not going to have to pay more for premiums over a certain percentage of their income. And so this just means like the subsidies are getting like really expensive for the federal government, which goes back to the issue of kind of like why Democrats didn't extend these enhanced premiums indefinitely, because it's just expensive to do it. Like, this is the government subsidizing private health insurance. And then it's also significant, again, for those people over 400% poverty who had a cap on what they would pay. I think it was 9.5% of their income under the enhanced, and now they have no cap.
I think it's 8.5% of their income actually under the enhanced premiums.
Under the enhanced, okay.
It's going to go back to 10%.
Yeah. But there's no cap if you're like over 400%. Right. Yeah.
That's right.
Yeah. But that's why people are confused. And the other thing is, like, the administration is correct that the vast majority of people in the marketplaces will continue to get subsidies. And we are basically going back to what the situation was before COVID. But it's that like smaller number of people that are at the higher income levels. But the other thought I had was, of course, the healthcare industry and Democrats are talking a lot about this and spreading these huge premium increases, far and wide and making sure everybody hears about them. But it's like a relatively small number of people if you think about it. And I think it's only like a couple million people in the marketplaces who are at that higher income levels. And I wonder if that factors into Republicans' calculations here, where they're looking at how many voters are actually seeing these massive premium increases, having to pay for all of them. And like in the whole scheme of the U.S. population, it's not like a ton of people. So I just wonder if that's one reason they're sort of like seem to be increasingly dug in on this and very reticent to extend these subsidies.
Although I would point out that when the Affordable Care Act started, it was only a small number of people who lost their insurance, and that became a gigantic political issue.
This is very true.
So it's the people who get hurt who sometimes yell the loudest.
Yep.
Although you're right. I mean, at that point, the Democrats stayed the course, and eventually, as Nancy Pelosi said, people came to like it. So it could work out the same way. It does help explain why everybody's still dug in. Maya, you wanted to say something.
I was just going to say, I think it'll be interesting to see if subsidies aren't extended, how this affects premiums next year for people and for the federal government, because if a couple million people drop out of the ACA marketplace because it's too expensive, and those people tend to be healthier, then the remaining pool of people is sicker, and then that's the death spiral, right? So
yeah, although it is only the death spiral that goes back to prior to COVID, which it was kind of stable at 12 million. I'm sort of amused by seeing Republicans complaining about subsidizing insurance companies. It's like, but this was the Republicans' idea in the first place, going back to the very origin of the ACA.
And we should not forget that there is a group of people who are going to be losing all of their subsidies, not just the enhanced subsidies, and that's legal immigrants. And that's hundreds of thousands of people. So like Maya said, that will probably mean a lot of, younger, healthier people dropping coverage altogether, which will make the remaining pool of people more expensive to insure. So, these things have ripple effects. Things that impact one part of the population inevitably impact other parts of the population. And again, these are legal, tax-paying immigrants with papers will be subject to the full force of the premium increases because they won't have any subsidies.
Yes, our health system at work. All right, we're going to take a quick break. We will be right back with more health news. Moving on, the federal government is technically shut down, but the Trump administration is still making policy. You might remember last summer, a federal judge blocked a Biden administration rule that prevented medical debt from appearing on people's credit reports. The Trump administration chose not to appeal that ruling, thus killing the rule. Now the administration is going a step further, this week putting out guidance that tries to stop states from passing their own laws to prevent medical debt from ruining people's credit and often their ability to rent or buy a house or purchase a car or even sometimes get a job. According to the acting head of the Federal Consumer Financial Protection Board, Russell Vought, yes, that same Russell Vought, who's also cutting federal programs as head of the Office of Management and Budget, states don't have the authority to restrict medical debt from appearing on credit reports. Only the federal government does, which of course he has already shown he doesn't want to do. Who does this help? I'm not sure I see what the point is of saying we're not going to do it in states. You can't do it either. Part of this I know is, Russell Vought has made no secret of the fact that he would like to undo as much of the federal government as he can. In this case, is he doing the bidding of, I guess it's the people who extend credit who I guess want this information, want to know whether people have medical debt, think that that's going to impact whether or not they can pay back their loans, or is this just Russell Vought being Russell Vought?
I guess in theory, maybe it goes back to the idea that if you have consequences for medical debt, then people will pay their bills. And maybe that would help the health systems in the long run. But, I also think that I don't know what health systems have said about this particular move, to be honest. But I think there's interest in making medical debt less difficult for people to bear in the whole health system. So I'm not sure how popular that is.
Yeah. Yes, another one of those things that's sort of like, we're going to hurt the public to, thwart the Democrats, which kind of seems to be an ongoing theme here. Well, as we tape this morning, the Senate Health Committee was supposed to be holding a hearing on the nomination of RFK Jr. MAHA ally Casey Means to be U.S. Surgeon General. Casey Means was going to testify via video conference because she is pregnant, but apparently she has gone into labor, so that hearing is not happening. We will pick up on it when that gets rescheduled. Perhaps she will appear with her infant. Back at HHS, a U.S. district judge this week indefinitely barred the Trump administration from laying off federal workers during the shutdown. But at the Centers for Disease Control and Prevention, it appears the damage is already done. The New York Times' global health reporter, Apoorva Mandavili, reports that the agency appears to have had its workforce reduced by a third, and that the entire leadership now consists of political appointees loyal to HHS Secretary Kennedy, who has not hidden his disdain for the agency and the fact that he wants to see it dissolved and its activities assigned elsewhere around the department. What would that mean in practice if there, in effect, was no more CDC?
Hopefully we don't have another pandemic. There's just a lot of stuff the CDC does. And it's been really confusing to follow these layoffs because in this last round, I remember trying to figure out with my colleague Lena Sun how many people were sent notices, and then hundreds were those were rescinded and they were brought back. But yeah, I mean, I think we're going to see the effects of this over the next couple of years. When I've asked the administration broadly about the reductions to HHS, what they say is that the agency overall has grown quite a lot in its headcount through the pandemic, which is true. I think they got up to like 90,000 or so. And then according to our best estimates, maybe they're back around 80,000, although I'm not entirely sure if that's accurate. Again, it's really been hard to track this.
Yeah, I've seen numbers that as low as 60,000.
It may be lower. Yeah. So I think actually the 80,000, that may have been the head count before the pandemic. Anyway, all that to say, it did grow during the pandemic, and that's kind of the argument that they're making, is that they're just bringing it back to pre-pandemic levels.
But CDC, I mean, it really does look like they want to just sort of devolve everything that CDC does to the states, right? I mean, that we're just not going to have as much of a federal public health presence as we've had over these past 50, 60 years.
For sure. They've definitely targeted CDC. I mean, they mostly left CMS alone and FDA because statutorily, I think it's easier for them to shrink CDC, but it definitely is going to have massive effects over the next couple of years, especially as we see future pandemics.
And the whole argument about, returning to pre-COVID, that doesn't fit with what they're actually cutting. I mean, they're gutting offices that have been around for decades, focused on smoking, focused on, maternal health, all these different things. And so this is not just rolling back increases from the past few years. This is going deeper than that.
Well, yeah, it's not like they're just cutting the roles that were added since the pandemic.
Exactly.
It's not a last in, first out kind of thing. Well, as I said, since it looks like public health is now mostly going to be devolved to the states, let's check in on some state doings. In Florida, where State Surgeon General Joseph Ladapo last month announced a plan to end school vaccination mandates, my KFF Health News colleague Arthur Allen has a story about how health officials, including university professors and county health officials, who actually do believe in vaccinating children, are effectively being muzzled, told they cannot speak to reporters without the approval of their supervisors, who are likely to say no. Seeing the rising number of unvaccinated children in a state like Florida, where so many tourists come and go, raising the likelihood of spreading vaccine-preventable diseases, this all seems kind of risky, yes?
Yes, that was a fantastic article from your colleague. And there was a really illuminating line, which I think had been reported before, but a reporter asked the Surgeon General if he had done any disease modeling before making the decision. And he said absolutely not, because this to him was a personal choice issue and not a public health issue. And I think that just goes to show that we have no idea what is going to happen as a result of this public health decision. And it could have massive ripple effects.
But what we are already seeing are the rise of vaccine-preventable diseases around the country. I mean, measles, first in Texas, now in South Carolina, whooping cough in Louisiana. I'm sure I am missing some, but, we are already seeing the consequences of this dwindling herd immunity, if you will. Alice, you're nodding your head.
Yeah. And, I've heard from experts that measles is really sort of the canary in the coal mine here because it's so infectious. It spreads so easily. You can have an infected person cough in a room and leave the room, and then a while later, someone else comes in the room and they can catch it. Not all of these vaccine-preventable illnesses are like that. So the fact that we're seeing these measles outbreaks is an indication that other things are probably spreading as well. We're just not seeing it yet, which is pretty scary.
And of course, one of the things that the CDC does is collect all of that data. So we're probably not seeing it for that reason, too. Meanwhile, in Texas, Attorney General and Republican Senate candidate Ken Paxton is suing the makers of Tylenol. He's claiming that Johnson & Johnson spun off its consumer products division, that includes not just Tylenol, but also things like Band-Aids and baby shampoo, to shield it from liability from Tylenol's causing of autism, something that has not been scientifically demonstrated. By the way, even Secretary Kennedy admits that it has not been scientifically demonstrated. My recollection, though, is that Johnson & Johnson was trying to shield itself from liability when it spun off its consumer products division, but not because of Tylenol, rather from cancer claims related to talc in its eponymous baby powder. So what's Paxton trying to do here beyond demonstrate his fealty to President Trump and Robert F. Kennedy Jr.?
I was interested to see some GOP senators distancing themselves from the Texas lawsuit and saying, like, look, there is no proof of this connection and this harm. Let's not go crazy. But as I've reported, it's just very hard to get good information out to people because there just isn't enough data on the safety of various drugs, because testing drugs on pregnant women was always hard, and it's gotten even harder in recent years. And so based on the data we have, this is a correlation, not causation. But, it would be easier to allay people's fears if we had more robust and better data.
Yeah. Does a lawsuit like this, though, sort of spread give credence to this idea that, I see you nodding, Maya, that there is something to be worried about using Tylenol when pregnant, which is freaking out the medical community because Tylenol is pretty much the only drug that currently is recommended for pregnant women to deal with fever and pain.
Yeah, I think some of my colleagues have reported on the concern of another death spiral here, right, where people get concerned, perhaps without basis, of taking Tylenol and then, or any other drugs, vaccines even, because there are lawsuits. And then the makers of these drugs say it's not worth it for us to make these anymore, and then they don't make them. And then, it's like a bad cascade of events. And so it's obviously too soon to see if that's what's happening here, but it's certainly something to watch.
But as we pointed out earlier, not treating particularly fever can also cause problems. So it's
right. Basically, all of the alternatives are more dangerous. Not taking anything to treat pain and fever in pregnancy can be dangerous and can lead to birth defects. And taking other painkillers and fever reducers are known to have dangerous side effects. Tylenol was the safest option known to science, and now that that's being questioned in the court of public opinion, people are worried about these ramifications.
I think about the effect on moms who have kids with autism who are now thinking back to their pregnancies and thinking, oh my gosh, how much Tylenol did I take? I know I had pregnancies that I took plenty of Tylenol during. My nephew has autism, and I was talking to my sister about this, and she was like, I took Tylenol, and what they're doing is, I guess the other reflection I have on it is, in general, there's just less research on most things than we need. And there are some studies showing a correlation, which, as we all know, is not causation. And what it looks like the administration did was they took those tiny little nuggets of suggestions and have blown them up into this overly confident declaration of Tylenol and pregnancy, and probably unnecessarily causing many women to blame themselves or think, should I have done something differently during my pregnancy, when they were really just doing what their doctor recommended they do.
I'm surprised that we haven't seen legal action from Tylenol yet. I imagine we might at some point, especially if there is some kind of government action around this, like a label change. I think we will see some sort of legal action from the company, because this is absolutely going to impact their bottom line.
Yeah. All right. Well, finally this week, more news on the reproductive health front. California announced it would help fund Planned Parenthood clinics so they can continue providing basic health services as well as reproductive health services after Congress made the organization ineligible for Medicaid funds for a year in the big budget bill passed last summer. California is the fourth state to pitch in, joining fellow blue states Washington, Colorado, and New Mexico. Meanwhile, family planning clinics in Maine are closing today due to that loss of Medicaid funding. And at the same time, the Health and Human Services Office of Population Affairs, which oversees the federal family planning program, Title X, is down apparently from a staff of 40 to 50 to a single employee, according to my colleague, Celine Gounder. Is contraception going to become the next healthcare service that's only available in blue states, Alice?
So Title X has been in conservatives' crosshairs for a long time. There have been attempts on Capitol Hill to defund it. There have been various policies of various administrations to make lots of changes to it. Some of those changes have really limited who gets care. And so it's been a political football for a while. Of course, Title X doesn't just do contraception. It's one of the major things they do. Providing subsidized and sometimes even free contraception to millions of low-income people around the country. But, they also provide STI testing, even some infertility counseling and other things, cancer screenings. And so this is really hitting people at the same time as, the anticipated Medicaid cuts. And at the same time, Planned Parenthood clinics are closing because they got defunded. And so it's just one on top of another in the reproductive health space. Each one alone would be really impactful, but taken all together, there's a lot of concern about people losing access to these services.
I think the politics of this are more interesting to me than the practical effect. I mean, under the ACA, birth control has to be covered, right, by marketplace plans. Generally speaking, if people have insurance, they do have coverage for a range of birth control. But the Title X program is interesting because it seems like overlap between the MAHA priorities and the social conservatives. Of course, as Alice said, this has long been a target of social conservatives. I think in Project 2025 called for ending Title X, I believe. And then there's kind of this current in the MAHA movement that's kind of anti-hormonal birth control, and there's kind of also these kind of streams of pro-natalist people of have more babies, don't take birth control. So that's kind of interesting to me because there's this larger narrative I think in HHS right now of the RFK MAHA people versus the traditional conservative anti-abortion people. So that's just one program where I kind of see overlap between the two.
One of my favorite pieces of congressional trivia is that Title X has not been reauthorized since 1984, which, by the way, is before I started covering this. But I've been doing this 39 years, and I have never covered a successful reauthorization of the Title X program. So it's obviously been in crosshairs for a very, very long time. Maya, did you want to add something?
I was just going to say, to Paige's point, telling women that they can't take any painkillers during pregnancy is not a good way to raise the birth rate.
Yes.
So
also a fair point. Well, meanwhile, red states are trying to expand the role of crisis pregnancy centers, which provide mostly non-medical services, and try to convince those with unplanned pregnancies not to have abortions. In Wyoming, state lawmakers are pushing a bill that would prohibit the state or any of localities from regulating those centers, quote, based on the center's stance against abortion. This comes after a similar proposal became law in Montana. The efforts being pushed by the anti-abortion group Alliance Defending Freedom. Is the idea here to have crisis pregnancy centers replace these Title X clinics and Planned Parenthoods?
I think there are a lot of people that would like to see that. But as you said, they do not provide the same services. So it would not be a one-to-one replacement. Already, there are way more crisis pregnancy centers around the country than there are Planned Parenthood clinics, for example. But that doesn't mean that everyone has access to all the services they want.
And many of these crisis pregnancy centers don't have any medical personnel, right? I mean, some of them do, but...
It's really a range. I mean, some have a medical director, on staff, or maybe there's, one medical person who oversees several clinics. Some do not. Some offer ultrasounds. Some don't. Some just give, pamphlets and diapers and donated items. It's just really a range around the country. And states have also been grappling with how much to, on the conservative side, support and fund such centers. And on the other side, states like California have really gone to battle over regulating, what they tell patients, what they're required to tell patients, what they can't tell patients. And that's gone into the courts, and they've fought over, whether that violates their speech rights. And so it's a real ongoing fight.
Yes, I'm sure this will continue. All right, that is the news for this week. Now it's time for our extra credit segment. That's where we each recognize a story we read this week we think you should read too. Don't worry if you miss it. We will put the links in our show notes on your phone or other mobile device. Maya, why don't you go first this week?
Sure. So this story is from KFF Health News and New England Public Media. It's called As Sports Betting Explodes, States Try to Set Limits to Stop Gambling Addiction by Karen Brown. And I think this stood out to me because I was just in Vegas last week for health. But this, I think, is a really interesting issue to explore through a public health lens, the issue of sports betting and betting addiction. And there are states that are trying to do a lot of work around this and just organizations. And then, of course, the gaming companies themselves have their own pushback on that. And I think this story just lays it out really well. And it's an important issue that gets very overlooked.
Yeah, it is a public health issue, an interesting one. Alice.
I chose a story from ProPublica by reporter Eric Umansky, and it's called Citing Trump Order on Biological Truth, VA Makes It Harder for Male Veterans with Breast Cancer to Get Coverage. So this is one of many examples that you could give of policies intended to target transgender folks having spillover effects and impacting cisgender folks too. In this instance, it's now harder for male veterans to qualify to get treatment for breast cancer. Men can get breast cancer. Let's just say that. Men can and do get breast cancer, and it can be harder to detect and very lethal and obviously very expensive to treat if you don't have coverage. And so this story has a lot of sad quotes from folks who are losing their coverage, especially because they likely acquired cancer by being exposed during their service to various toxic substances. And so I think, a
combination of a lot of different factors in that story.
Definitely.
Paige.
Yeah, so my story is by actually my colleague, Mark Johnson. I sit next to him at the Post, and the headline is Study Finds mRNA Coronavirus Vaccines Prolonged Life of Cancer Patients. I was really struck by this story because it talks about how patients with advanced lung cancer, they were given the COVID vaccines, and it somehow had the effect of supercharging their immune systems. And actually, their median survival rates went up like by 17 months compared with those that weren't given the vaccines. And of course, this administration has really gone after the COVID vaccines and the mRNA research in particular and canceled $500 million in funding for mRNA research. And all of the, ACIP's moves on vaccines have gotten so much attention. But I sort of think the thing that also is going to be perhaps even more impactful is pulling back on this really promising research because it has sort of become politicized because the COVID vaccines have become politicized. And it seems like a shame that we're pulling back on this really promising research. So I thought that was a really interesting story by my colleague.
Yes, yet another theme from 2025. My extra credit this week is from my KFF Health News colleague Bernard Wolfson, and it's called Many Fear Federal Loan Caps Will Deter Aspiring Doctors and Worsen MD Shortage. And it's a good reminder about something we did talk about earlier this year when the Republican budget bill passed. It limits federal grad school loans to $50,000 per year at a time when the median tuition for a year in medical school is more than $80,000. The idea here is to push medical schools to lower their tuition, but in the short run, it's more likely to push lower income students either out of medicine altogether or to require them to take out private loans with more stringent repayment terms, which could in turn push them into pursuing more lucrative medical specialties rather than the primary care slots that are already so difficult to fill. It's yet another example of how everybody agrees on a problem. Medical education is way too expensive in this country, but nobody knows quite how to fix it. Okay, that is this week's show. Thanks this week to our editor, Emery Hudeman, and our producer-engineer, Francis Ying. A reminder, What the Health is now available on WAMU platforms, the NPR app, and wherever else you get your podcasts, as well as, of course, KFFHealthNews.org. If you already follow the show, nothing will change. The podcast will show up in your feed as usual. Also, as always, you can email us your comments or questions. We're at whatthehealth, all one word, at KFF.org. Or you can find me on X at J. Rovner or on Blue Sky at Julie Rovner. Where are you folks hanging these days? Maya?
I am on X as Maya Goldman _, and I'm also on LinkedIn, just under my name.
Alice?
At Alice Miranda on Blue Sky and at Alice Olstein on X.
Paige?
I am still at PW _Cunningham on X.
Great. We will be back in your feed next week. Until then, be healthy.